Nausea, a basic human sensation controlled by the brain, has remained an enigma due to the fact that its neural pathways have been largely understudied. Within the field of cancer, nausea or emesis has been implicated as a common side effect of chemotherapy, a well-established method of treatment. In order to better understand nausea, scientists have begun studying its molecular basis. One focal area of research has been the neurotransmitter serotonin and its activation in the chemoreceptor trigger zone of the brain. Serotonin is a monoamine neurotransmitter synthesized from the amino acid tryptophan. It plays a role in multiple central nervous system functions, including eating, mood, sleep, memory, and learning. While small amounts of serotonin are found in the central nervous system and in platelets, about 90% is found in the enterochromaffin cells of the gastrointestinal tract, where it is involved in regulating gastric motility. Receptors that bind serotonin are known as 5-HT receptors. One member of this family of receptors is the 5-HT3 receptor, which is a pentameric ligand-gated ion channel found in both the central and peripheral nervous systems. Structurally similar to the nicotinic acetylcholine receptor, the 5-HT3 receptor is generally heteropentameric with a central pore that acts as an ion channel. Some studies suggest that along with the 5-HT3A subunit, the 5-HT3B receptor subunit is also involved in drug-induced emesis. Chemically, serotonin attaches to the binding site on its receptor, causing a conformational change that allows for the flow of sodium and potassium cations through the central ion channel. The opening of the ion channel has excitatory effects as it results in the depolarization of the myenteric neurons. In the central nervous system, these 5-HT3 receptors are found in brainstem structures involved in emesis, including the area postrema and its connections with the nucleus of the solitary tract. Irritation of the gastrointestinal mucosa by chemotherapy activates these 5-HT3 receptors as cytotoxic chemotherapy agents cause a major increase in blood levels of serotonin and its major metabolite, 5-HIAA. This graph demonstrates an increase in serotonin metabolite secretion after the administration of cisplatin, with a peak level 6 hours after the start of treatment. Another study utilizes FOS cell counts to quantify serotonin levels in the brain after cisplatin injection in rats. Rats injected with cisplatin have significantly greater FOS cell counts in multiple brain regions 6 hours later than rats injected with saline. This indicates that cisplatin raises serotonin levels in these brain regions, including the nucleus of the solitary tract and area postrema, both of which are involved in inducing nausea. The presence of these chemicals in the blood activates 5-HT3 receptors in the chemoreceptor trigger zone, in turn releasing substance P, which activates NK1 receptors to cause an emetic response. The chemoreceptor trigger zone makes up part of the vomation center of the brain within the area postrema and the nucleus of the solitary tract. One of the ways the chemoreceptor trigger zone implements its effects on the vomation center is by activation of the opioid mu receptors and delta receptors. Chemoreceptors in the chemoreceptor trigger zone relay information about emetic agents in the blood to the adjacent nucleus of the solitary tract by the initiation of an action potential. This is caused by the chemoreceptor changing the electric potential of the neuron in which it is embedded, which then subsequently causes an action potential. Once stimulated by these action potentials, the nucleus of the solitary tract directs signals about these functions to a central pattern generator, which actually coordinates the sequences of physical movements during emesis. By understanding the molecular pathway and chemical process by which serotonin activates the chemoreceptor trigger zone, clinicians will be able to better treat nausea and vomiting. Directions for future study include determining which drugs can be used to target points along the pathway and inhibit activation of the chemoreceptor trigger zone. Ultimately, the goal is to find the best method of blocking serotonin binding in the gastrointestinal tract and in the nucleus of the solitary tract, which will reduce the emetic response in chemotherapy patients.